for doctors, for orthodontists. I've got reverberation. Maybe we should go try that. And I'll look for a thumbs up.
Sounds great, Kathy.
Okay, super. All right, I apologize for that. We have some technical opportunities. We try and select the best one, and I think we're going to land right here. So once again, my name is Kathy Turner, and I'm a part of HealthyStart, which is an orthotain company. I work in communications, and tonight we're communicating directly to the medical professional. And I think that you'll find over the next hour that you're going to be enlightened with a lot of information that's evolved over the last 50 years, that's fascinating, that you might want to apply into your practice and into your future. And you're also going to earn 1 CE credit for being with us this evening. We appreciate your participation tonight. Stay until the very end. You'll find out that we have another way of saying thank you and appreciating that you're with us, because we're going to give you an incentive to take another step forward in working with our program. You're going to be hearing from Dr. Diana Batoon in just a moment. She is going to be sharing with you the full depth of information tonight. And I also would like to share with you that we are going to be learning a little bit more about this world changer, Dr. Earl Bergerson, and I want you to take notes. That would be great, but I also want you to interact with us. There's a Q&A right there on your screen, and Dr. Batoon would be happy at the end to interact with you and answer some of the questions, and there are a lot of them that are going to come up, and we know that. In fact, today I'm out here in Salt Lake City, and I just interviewed one of the doctors that's been a part of our program for some time, Dr. Brian Kraft, and he told me about how after all the years of practice and treating 4 out of 6 of his own children in a standard manner, that when he was enlightened to all of what's been happening over the past many decades, that it just absolutely blew his mind. And I know that that is a common kind of response to learning everything that has been discovered along this journey by Dr. Earl Bergerson. He's a genius. There's no question about that. You'll see that he's board certified. He founded the company of Orthotain back in 1967, and HealthyStart is the treatment system that you're going to be learning about. He taught at Northwestern University at the dental school there for 25 years. They don't have the dental school now, but the School of Law at Northwestern is going to be the home of a lecture that's coming up that will honor 50 years of Dr. Bergerson's career on August 4th and 5th. And that is a pretty good hint of what we have to offer you a little bit later on this evening as we come to the end and the conclusion of our webinar. Dr. Bergerson has treated 3.5+ million children around the world. He has operations in 37 countries, and this is such a highly researched, highly studied, highly patented series of appliances that you're going to learn about. The patent attorney tells us that with the 514 current patents that are domestic and US, and that is added to a list of those that have come and gone and expired, he is the most prolific patent developer since Thomas Edison. So what we're going to be looking at is an appliance that has attributes that you can feel so very good about. The children love them. Sometimes we'll refer to them as a pillow for the teeth, but they're completely safe and FDA approved. There's no BPAs, there's no silicone, there's no latex. They also have the Health Canada certification. You'll see that we have all the ISO numbers, and it's an American-made appliance. So this is something that you can feel very good about. Parents, when they see a presentation like this, they always get it. They understand because of the pure logic involved. Now, I want to tell you a little bit about one of our premier lecturing doctors. This is Dr. Diana Batoon, DMD. And she was born out in the San Francisco area, and she is really the type of doctor, and it's great to have kind of the sense of who they are, where they come from, what their philosophy is, so as you're learning a little bit more from them, where they're coming from. But she invites her patients and the audience tonight to question the popular misconceptions and really to face the intimate connection between the oral health and the overall health. And her insight really does generate a lot of enthusiasm and momentum for change. And there is change, and it's happening, because once you know this, You cannot unknow this. Dr. Diana received her graduate from Tufts University Dental Medical School in 1996, and she founded Bonita Dental in Scottsdale, Arizona. She's an active member of the AADSM, the ADA, the AGD, and a faculty club member of SPEARS, Education and CEREC Doctors. So she is a frequent speaker for us. She speaks to you tonight in a webinar, perhaps in a live lecture, overseas many times. She just got back from Manila, and she just is absolutely on fire with the information that we are going to be sharing with you. She's with her husband and 3 kids out in Arizona, and she's also on live television, on big screens, and in the classroom, because part of what we do for our lectures is the hands-on training in most situations. So I'm going to turn everything over to Dr. Diana Batoon, but I'm going to remind you, please address the questions through that Q&A box. Hope you have yourself, like me, a nice cup of tea to enjoy the next 45 minutes to an hour. Get your questions answered. Get on the ball with what we have with HealthyStart and Orthotain. So Dr. Diana Batoon, go ahead, share your screen, and I will be working from behind on this end as Susie Lafredo is manning the operations. Dr. Diana?
Thank you, Kathy. It's so exciting to be here tonight. We have some great information to share with all you doctors. It's amazing to me that HealthyStart did not create momentum earlier, because there are so many children out there that could benefit from what we're going to talk about today. And so with that, let's get going. And like Kathy said, questions are very welcome. So use your Q&A box if you'd like. And we're going to get going on our PowerPoint here. So let me see if we can get, here we go. Okay, so, you know, there's a silent crisis that's occurring among Americans' children today. And if you take a look at this table, there are so many children that are suffering from one or more of these symptoms. And we find it so frequently in today's society, and yet these children are struggling. They're put on medication, they're struggling in school, they're having behavioral issues, whether that's at home or at school. But the number one thing, too, is they're not sleeping very well. An estimated 9 out of 10 kids suffer from one or more of these symptoms. And Dr. Bergerson actually did a study, we're going to talk about that later on, to prove that this does occur in today's society. Well, what options do parents have nowadays? Not very much. And some are very costly. We could certainly put children on drugs. We can put them through sleep tests, sleep aids. We can put them through, you know, more invasive procedures that involve either special education or tutoring or counseling, even psychiatric testing. There are a lot of children today that are on such drugs like Ritalin, and maybe you may know one or more children that are taking this medication on a daily basis. Well, what do these conventional treatments have in common? They address the symptoms and not the root cause. They tend to be short-term Band-Aids. They often involve several drugs with many side effects. But they can also be costly, time-consuming, and sometimes ineffective. There's been so much research over the last 20 years that has linked each of these symptoms to a root cause. And those symptoms that I'm talking about are mouth breathing, a narrow palate, improper tongue placement, and jaw relationships. And what do they have in common? Well, we're going to talk about that in more detail. As dental professionals, or even medical professionals, we have the knowledge and the tools to impact what's happening today in a children's life. We also have the proper tools to impact the development of a child's airway. And that's what we're talking about here. Not only are we healthcare professionals, but we can help a child grow and develop in a normal fashion without the help of drugs. Because it's not about cavities or straight teeth anymore. It's about the overall well-being of the child. It's about their overall health. And I think when you listen today, after an hour of listening to all this information, you'll go back and you'll think about maybe yourself as a child, or someone you know, or even your own children, or people, patients in your practice that this may apply to. Today we're going to learn about how to identify sleep disordered breathing symptoms. We're going to evaluate those symptoms, and we're going to help to understand and identify the root cause. After we've evaluated the problem, we're going to look at a system that helps to treat this. So let's take a look at these pictures. Does this look like a healthy child to you? They don't look too happy. And if you notice underneath their eyes, right here, there's some venous pooling, we call it. And venous pooling is very apparent in some kids because that is the thinnest part on our face. And when we have deoxygenated blood, it's going to be more visible in that area than anywhere else on the face. Take a look at these two girls. Looking at their profile shot, first we would think, is there something wrong? I'm not really, quite sure what I'm looking at. But as dental professionals, we could probably see here that this mandible is really set back. So what does that translate to clinically as far as what do the teeth look like? This female to the right, is she really have that much soft tissue, or why does she have a rolled lower lip? What does her jaw relationship look like? Well, the root cause is, number one, there's mouth breathing. That allows the mandible and the tongue to be displaced posteriorly. That could cause a reduced airway and reduce air exchange to the lungs. We know that's true for adults. I'm sure we know many adults nowadays that have sleep apnea. And what is their breathing like? They were probably mouth breathing as a child. Also, habits like finger sucking, thumb sucking, that's going to create an abnormal swallow. An upper arch constriction or a high palate, that's going to decrease the nasal breathing by impacting the nasal floor in the maxilla. All of this reduces REM sleep. What does that cause? It decreases the hormones that are secreted by the brain. That's going to affect the brain function, all the endocrine and immune systems in our body. It is all connected. Here's a diagram of showing normal craniofacial growth. HealthyStart system is very effective in that age window of 2 to 17. And because the head is still growing, there's an opportunity to affect the jaw relationships and the permanent teeth that are erupting in that pattern. At 12 years old, 89% of males are at completion of craniofacial growth, and 94% of females, their craniofacial growth is completed. And we do see that. We see that females mature first before males. We see that their growth, they have a growth spurt in the beginning, then the males catch up, and that's why we also put that there is a window where we can work with kids up to 17 years old, because age-wise, they may be 12, but dentally, they may be 11 or 10 and a half. The normal growth and development of the face and jaw is forward and downward. So why are so many of those children not experiencing this growth pattern? Well, we know that in our Western society, there are many foods out there that, melt in your mouth. And with these toddlers or these children, they're not using their tongue muscle. They're not using their jaws and their cheek muscles and their lip muscles. So they have a weak tongue muscle, number one. Number two, they're not exercising all of that in the oral cavity. We know that there is long-term effects of a prolonged pacifier use. There's long-term effects of prolonged bottle use. And also with the lack of breastfeeding and soft diet that's present, these can all affect the jaw relationships of the maxilla and mandible. The result of having pacifier or prolonged bottle use, I'm sure you've seen children with this open anterior bite, and the result of that, and how that affects their permanent incisors that are erupting. The first thing that you need to know is pay attention to the anatomy of an airway. And I think when we understand all the parts of airway, we can start to look at patients in our office or patients we know with how everything is positioned. Is there a problem in their nasal cavity? They have chronic allergies. Is there a reason why they can't breathe through their nose? Are they mouth breathing when they're sitting in the dental chair, or they're sitting in the waiting room, or they're actually just watching electronics? Are their lips closed, or is their mouth open? When they have dinner, when they have breakfast or lunch, when they are chewing their food, Are they making loud noises? Are their lips closed when they're chewing and eating? The nose is a fascinating thing. In fact, nasal breathing is probably the key to having a healthy life. It has 5 functions. It serves as an air passageway. It warms and moistens inhaled air. The cilia and the mucous membrane help get rid of the bacteria that the body doesn't need. And it also contains receptors that help us with odors or smelling different types of foods. It also aids in the quality of our voice and the phonetics when we're speaking and talking. When we have improper air exchange, that causes effects in the lungs, and that probably is going to promote nighttime mouth breathing. We see that present in 43% out of a study that Dr. Bergerson did in 2016 among 500 children. So this was a child, Eli. He's a toddler. And I'm sure you see these pictures probably even so more frequently on Facebook when moms are posting their children falling asleep. They can't really be sleeping very well. And this type of sleeping causes airway constriction. And if we don't correct it now, it'll be harder to correct as an adult. And that's why we see so many adults now struggling and having a higher percentage of sleep apnea as they get older. Those adults actually had airway issues as children. The airway, here's a lateral ceph, and it's the patient is 5 years old. And what we can see is here is a restricted airway, and that is the normal position of their airway. And it could be, daytime or nighttime. Here is what a normal airway should look like. Should look very open, very patent, like a garden hose. When a child mouth breathes, especially at night, it can constrict their oropharynx as much as 6 millimeters, a ½ inch of an open mouth. So if that child can't close their lips together, the tongue falls back, the jaw's already retreated, there we have a restriction in the airway. You might expect to see that this child snores very frequently. You might expect this child to have recurrent ear infections. You might expect this child to have had tubes when they were an infant and have chronic allergies or a history of asthma or respiratory issues. So this is what we were talking about. The airway should look like a garden hose instead of a coffee stir stick. And if you've ever analyzed a coffee stir stick, that isn't very much opening for air to be exchanged. So here is a table that really explains the cycle of what we're seeing in children. And what I want you to just understand is that mouth breathing or snoring can cause a compromised airway. That in turn can cause sleep disordered breathing. And the most important fact is that snoring is not healthy. It's not healthy as an adult, and it definitely is not healthy as a child. You might expect that these children who, had some habits or were bottle fed or had prolonged use of bottle or pacifier, they may have a poor tongue position, let alone they may have a tongue tie that cannot allow their tongue to go to the roof of their mouth so that tongue can form the shape of the maxilla. They can't possibly breathe through their nose if they have a tongue tie. And here's the thing, when we learned in dental school what a tongue tie looked like, it was probably a heart shape with the frenum really pulling tightly on it. Nowadays, I see tongue ties and there is no heart shape. And those children are chronic mouth breathers. So the issue becomes we need to think out of the box. We need to take a good medical history to evaluate why is this child mouth breathing? Why are they snoring? Is it a result of having swollen adenoids or tonsils? They are definitely not going to be breathing through their nose because they've got some anatomical issues that need to be addressed, either by an ENT or an allergist or their pediatrician. Okay, that in turn is going to cause an underdeveloped maxilla and mandible that could create an open bite or crossbite. That in turn causes these children not to sleep very well at night. And you might see that they may have an issue with bedwetting, right? Because there are some 9-year-olds and their parents will tell me, oh no, they don't bedwet, they wear pull-ups. But the whole honest truth is wearing pull-ups means they have a bedwetting issue. They could be experiencing chronic allergies, and those children are probably taking Zyrtec or Allegra every day as a child. They most likely will have to take that as an adult. There are children that have nightmares that actually sleepwalk or sleep talk. And I don't know what happened here, Susie. But anyways, so let's talk about how HealthyStart addresses the root cause. It's going to expand the dental arches. And how we do that is an appliance called the habit corrector, which is applicable in 70% of the cases that require expansion. There are some kids out there that actually, who may have symptoms of ADD or ADHD, that have sensory issues, that maybe a palatal expander might be not so easy to deal with, or a child who has Down syndrome. Well, a Schwartz expander quad helix is used in about 18% of the cases, a rapid palatal expander in about 4.8%. So what's great about the habit corrector is you are not only expanding the maxilla, you are also helping the airway. It also establishes nasal breathing. We're helping these children to train them to breathe through their nose. And the habit corrector helps with that tongue position. It also increases the oxygen intake and helps with REM sleep. We know we're going to help train the tongue to strengthen that. We talked about that earlier. We're also going to help put the tongue in the right position up towards the palate to help form the maxilla, prevent the high palate, V-shaped palate. We're also going to promote a proper swallow that's going to help with speech so that when kids enunciate S's, F's, and V's and R's, that they are able to articulate those consonants and vowels normally without difficulty. The other thing is we're going to eliminate bad habits like thumb sucking and anterior tongue thrusts. We see that so often in children who are mouth breathing. We can eliminate and correct a reverse swallow and eliminate an open bite. We also, HealthyStart, can advance the mandible to correct the overjet. That's going to increase the airway and can correct most of the symptoms that are caused by sleep deprivation. It's going to encourage the proper facial growth and help with REM sleep, and it's going to correct most orthodontic problems to an ideal overbite and overjet, and allow the proper interdigitation, intercuspation of the teeth. And we're going to have room for all the permanent teeth, believe it or not. We're not going to have to extract any premolars. We're going to create that space. And so when that allows the maxilla and the mandible to develop properly, we're actually preventing future relapse. And that's because the collagenous fibers have matured without any interference from the tongue thrusting forward. The other thing is we're going to reduce the chance for orthodontic treatment later. So there was a study that Dr. Bergeson did in 2016, and he polled children from the age of 2 to 19, and it was published in the JAOS. It talked about the incidence of sleep disordered breathing in this age bracket. This sleep questionnaire was developed, and what it did is it had a parent evaluate initially some of the symptoms that their child were experiencing it and ranking it from 0 to 5. Then in a follow-up visit, after starting in the HealthyStart system, they would fill out the same questionnaire filled out by the same parent on a follow-up visit, usually 2 to 3 months after. And what we found was those symptoms improved to where they were once 3, 4, or 5 were actually 0 or eliminated, or maybe went down from a 5 to a 1. The result, that mouth breathing and snoring are commonly associated with sleep disordered breathing symptoms. And that's where we came out with that statistic that 9 out of 10 children had 1 or more of those symptoms. 60% had 4 or more, and 1 out of 5 children experienced bedwetting. You know, what's interesting is bedwetting is such a taboo subject to talk about it. In my practice, when we've started Children in HealthyStart, and we've had them fill out that follow-up questionnaire, the parent will say, oh yeah, and the bedwetting stopped, where they didn't even mention it in the beginning. And that's because they're not proud to talk about that openly. But there are some families that are struggling with that issue, and their child may be school-age children. Sleep deprivation, and this is just the same study, it's broken out into more percentages, but what's most important to note is usually mouth breathing at night, they're going to have some snoring. And so the most urgent need for diagnosis are listed in bold, and I'm sure you can agree that this really should be addressed. We find when we help a child to nasal breathe at night that the talking, the sleep, waking up at night stops, the difficult labor breathing improves, the mouth breathing during the day and the night improves, and actually some of those children who have been not diagnosed but been told that their child may exhibit some signs and symptoms of ADHD actually goes away. It's just that the child didn't sleep very well at night. So the average number of symptoms presented in this children, here's a graph from that study to just show you and breaks it down to, divided among those 500 children, the symptoms that they experience. I mean, we probably see a lot of kids that fidget with their hands or have restless sleep, but also a number of children teeth grinding. I remember back when I graduated from dental school, there wasn't very many dental studies or research that would explain the cause of teeth grinding in children besides the fact that, oh, maybe they were stressed out, they had too many activities. Well, now there's dental research to prove that dental grinding is actually a result of child trying to find airway. And so we do see that in our adult patients too. The implications were to show that sleep disordered breathing is more common, affects children, even as young as 2. The most important thing is that the earlier we begin treatment, we can ensure permanent changes. Identifying those outward symptoms can really help significantly reduce that chance for that child to be put on medication or to have struggles in school as they get older. Here's a graph. It's an MRI. The top graph shows normal brain activity, and that's what those red dots are for. Below, this is brain function with 1 night of sleep deprivation. No red activity at all, hardly. And so it explains why children who are restless, why they're exhausted and why they're tired, and we're having to put them on medication to function during the day. Their body can't rest, their brain cannot remove the toxins that they need to, and so they're struggling. They're struggling with sitting still, they're struggling with computing math problems or spelling memory, and they're having struggles with hand-eye coordination in sport. So here's a list of studies. I'm not going to go through all of them, but it's to show you, and I think that most of you will agree, the less REM sleep we have, the more chance we have for it affecting our brain function, our reaction time, our judgment. It reduces our chance for higher learning, for memory, consistent memory, and attention span that can last longer. These types of plaques that are found in Alzheimer's were the same types have been linked to the same types of plaques that we see. So what's important to note too here at the bottom, which I think is very important, that the antibody levels are increased for each additional hour of sleep. The home take point of this is we need more sleep. We need adequate sleep. Children need proper sleep. So another example of why sleep affects children who are obese. It affects the hormones that tell us that our stomach is full. And so what we find are those kids actually have trouble stop eating. They just keep on eating, and that's why they eat also at night. They can have 3 meals a day, but those hormones are affected by that. It also increases these children for risk of type 2 diabetes. It affects their immune system. So we're going to see these children get sick more often. They're going to have less resistance to fight off infections, illnesses, allergies, and the viruses. Sleep disordered breathing and ADD and ADHD. It'd be interesting to know if you could take a poll in your practice of all those kids that you think may have ADD and ADHD and to ask their parents, how well do they sleep? I mean, there are a lot of kids that are being labeled with this, and the problem is once they're labeled, it can affect them socially and among their peers, their teachers, and their socialization among their friends when they play sports. The key results of the studies that Dr. Karen Bonnet did, she polled over 13 participants, was that it increased the risk of ADD, ADHD by 50%. These patients had little or no REM sleep. And we found out through that study that Dr. Bergerson did that ADHD was present in 25% of those cases. So what's important to note is to really pay attention to the sleep cycle of some children who are exhibiting signs and symptoms of ADD or ADHD. The long-term effects of sleep deprivation and sleep disordered breathing in regards to what we're talking about is that 50% of those were held back 1 grade. 30% were held back 2 grades. And we find that these children, when they become adults, they may struggle with holding down a job, with arriving to work on time. That would be interesting if you polled some of your prior employees who struggled with, showing up on time. How did they sleep? Or were they having issues with concentration? Or somebody did they have to take medication to stay on track? Well, sleep disordered breathing has a link with bedwetting. And what's really amazing to me is when I talk to parents about this, or even other colleagues, we don't think, as dentists, we don't think that this could be related. So what we know is that, that the reduced oxygen interferes with the normal sleep pattern. The lack of oxygen during the brain at sleep time affects those hormones that are responsible for keeping the bladder contracted. And so sometimes you might see a child come into your office that their parents may say, oh, he has constant headaches in the morning. Or they may share with you they have a bedwetting issue. Well, are they sleeping very well at night? Or what's inhibiting their growth pattern? There may be children that may be the shortest in the class. And this has happened to my own son, who was 12 at the time. Put him in HealthyStart. He had a growth spurt. So he wasn't one of the shorter kids in his class. He actually was tall. And so I think what's important to note is everybody doesn't remember the lack of oxygen can affect growth hormone. Let's talk about the habit correctors. Well, like Kathy said, is Dr. Bergerson has treated over 3.5 million cases worldwide, and they are all over the world. What's great about this, and what's a great selling point to your patients, to those of you who are dentists, is that it's FDA approved. There is no latex. It's PBA free, no plasticizers, no silicones. It's regulated to a Class 2 medical device. Guess what, folks? The HealthyStart system appliances, they're not a choking hazard. And so in order to be FDA approved, it cannot be a choking hazard. I think that is great to market to your patients, that you're providing a system that's actually safe, that's gone under so much research to prove that this does work and it's safe for their children when they sleep and when they exercise with the second appliance during the day. So here are the appliances in HealthyStart. They actually are categorized by ages. And so there's a toddler habit corrector, kids habit corrector, preteen, and teen and adult. Believe it or not, there is a window of people in this category that HealthyStart can help. And that information we'll find out if you sign up for one of our courses. What's great about the toddler habit corrector, it's going to strengthen the lip muscles as well as creating proper tongue placement. So what do HealthyStart corrects? Well, it corrects tongue thrusting, corrects swallowing patterns, mouth breathing, a low position, tongue position, all the habits that we talked about, thumb and finger sucking, open bites, Flared incisors, I see that a lot. Speech problems, underdevelopment of the mandible, like we saw in that profile shot, and a narrow palate. So the normal tongue posture should be right on the roof of the mouth, behind the rugae, and a slight spread of it, so that helps form the maxilla. That is going to happen with nasal breathing and with the lips closed. Abnormal tongue resting posture is more commonly looks like this. And I know you've seen patients like that. Or you may know somebody that just in normal position, their tongue is thrusting forward. Their lips are usually parted. And when they usually sleep with their mouth open. HealthyStart Habit Corrector encourages a proper swallow. So one of the things, and I'm not going to go over into detail, but you will be able to understand that if you take one of our courses, is the design of this habit corrector and how it actually helps the jaws to develop and create expansion at the same time. So, if you want to know if a child has a proper swallow, what you need to do is ask them to sip some water. And watch, are their lips closed? Are they perched? Are they having a hard time keeping their tongue back when they swallow? Is the movement on the neck or is it on the face for them to get that water back to the throat? What's important about HealthyStart's Habit Corrector is that we know that in a minute during the day, we swallow 2 times. In 16 hours, we are going to have 19-20 swallows. During sleep, it's estimated that we swallow 1 time a minute. In 8 hours sleeping, you're going to get 480 swallows for a total of 2,400 swallows. With the use of habit corrector during the day, it's going to create 240 swallows and sleeping 480. Here's the thing why we want to point it out. In myofunctional therapy, or somebody that's working with a speech therapist, they may go over the exercises, but what they do at home, how can you correctly evaluate if they're doing what they're saying at home? That's what the habit corrector does. It ensures that the child, number 1, swallows properly, but conditions and trains them to swallow properly. So the symptoms to look for anterior open bite are clearly, they look like this. The tongue thrust, it's going to fit in that space, and that's why they have an anterior open bite. Symptoms to look for excessive overjet with minimal overbite. You're going to see a deep bite. I know that you may have seen in your practices children that bite down and you hardly see their lower teeth. Flared upper incisors. Do they have a diastomy here? Was there a habit that was forcing the pattern of the upper incisors to grow outward? Thumb sucking, finger sucking. Is there a space? Are there rotations of the teeth? Deep bite. Constricted maxillary arch. We're going to see things tuck in. Do we have a cross bite on one or both sides? If the mandible is displaced to one side, we might have a midline shift. Cross bite on one side. What's causing that? Lingually tipped incisors. What's the reason for that? Are they sticking their fingers right in there that are pushing the incisors inward? Is there a large freeway space with a lateral tongue thrust there? What's happening? So there are certain things, and we're going to look at a couple right here in the next few slides. And we saw this picture of this girl earlier where she had a rolled lower lip. Well, what does her teeth look like? It looks like this. So after her being in 11 months of HealthyStart, her bite is like this. Less overbite, less overjet, and that deep bite is going away. So understanding childhood breathing issues is really key in the HealthyStart system. Not only are we evaluating orthodontic conditions, but we're evaluating the airway. I think that is really what's important and why this program is so successful. Here's a case study of a male who was 10 years old at the time, started HealthyStart. What's great about this is his profile shot. initially and after. And right here, here is his airway at 10.5 years old at 3 millimeters. Here is the final airway. At 14.5 years, he's got a 10 millimeter airway. We just reduced the risk for this gentleman, young gentleman, to have sleep apnea as an adult. I think that is just speaks to, it's such a phenomenon. It's so amazing that we can do that without any brackets or wires in this case. So let's take a look at some case studies. Here's a female. She's started when she was 5 and she's 7 years old. She's got a deep bite. See how those incisors are flaring a little bit? At 7 years old, we've corrected that. Nice profile, and her midline is on. So these are the side shots, and this is post-retention at 13 years. And she's not going to get relapse from this. A gentleman who started the system at 8 years old, completed at 14 years old. I think you saw this earlier where the incisors were flared out. There was a diastema there. Here is the case at 9 years old. Here's a case from when we're advancing the mandible at 9 years old to 11. And at 25 years old, post-retention, it still looks good. If you guys notice, here's a double lateral incisor, how we created space for that as well. So the appearance changed too for this guy who had the diastema and flaring front teeth, how we corrected that, and in the end. This is the same guy from the slides before at 9, 10, and 25. And you might not think, oh, there might not be anything wrong with this. Even a parent might not notice it. But as a dentist, you see those incisors flaring out. You see that maybe the mandible is protruded a little bit. Right here, you're starting to see a nice relationship between the nose, the upper lip, and the lower lip, and the chin. And here again at 25 years old, post-retention. Here's another case. The kid started at 12 years old, ended at 15. Taking a look at his profile, his chin almost looks like it is way ahead of his mandible, almost at the same point of his maxilla there. And look at the flaring of the upper incisors. Here, a nice relationship between the nose, maxilla, lower jaw, and chin. And this translates into what you're seeing occlusally on the maxilla. You can see here, this is V-shape, and now we've expanded that arch to make it more U-shape. So the HealthyStart, it also straightens teeth. That's the wonderful thing about it. It creates room for the tongue to rest too. So initially you might think if teeth are leaning in that there's not enough room for the tongue, but look at this. No brackets or wires, and we were able to do that with HealthyStart. 12-month and HealthyStart, before and after. Before and after. And what I like about it is right here, it looks like there might not be enough space for the tongue, but right here fits perfectly right there. So, you know, I think what's important to know is that if you are interested in implementing HealthyStart in your practice, you need to check the website out, you need to give them a call, and you should sign up for one of the seminars. I haven't met a doctor that hasn't been amazed about the information we share at a HealthyStart seminar. Not only are you expanding the types of things you could do in your practice, but you're helping children as well. There aren't many things in dentistry that we get excited over nowadays, right? I mean, with the low insurance reimbursement, the cost of all the fancy toys, this is fun dentistry. This is actually rewarding dentistry. And I think if you take a look at this system and see what it could do for someone you know or patients in your practice, you'll find that it really does benefit them in a positive way. And you establish yourself as a dentist who really takes care of their patients. So with that, I'd like to say thank you for listening in. And Kathy Turner is back.
I'm back, and I want to share more. And I'm so glad that everybody stayed with us, because what we would like to share with you is the fact that we have some more information, and I'm going to bounce right through this real quickly to get to the numbers that you just heard from Diana, but also that sleep questionnaire. That's the baseline. That's something that you're able to go in and download. And this is peer reviewed. I mean, this is something that is a proprietary, a HealthyStart, well designed start point for children. How about the well-designed start point for you? Well, tonight, because obviously you have CE credits for being with us, but I want to share with you something that's coming up. We've been talking about Dr. Bergerson and the fact that he has spent 50 years of his life devising this system, these series of appliances and what they're able to do. So take a look at this little girl. And the question is, can your dentist do this? And the reason that I promote that question is because that's what just went out in a press release, because basically you're looking at the possibility of changing a child from the inside out and for the rest of their life. So what you've just been talking about, Diana, is the fact that this is comprehensive, that what this appliance is able to do is change everything orally from the inside out and in a very short period of time. Not only is it comprehensive, but it's permanent. So this is something that dramatically changes the quality of health and the entire dynamics of the family. So at the 50-year kind of reunion, tribute, celebration happening in August, you are invited to be a part of that lecture. And if not that, we have a number of them. But we are also, and we're so glad that you're with us, we're also offering you an opportunity to be with us and take $900 off of what the typical lecture costs. That's $3,400, and now with $900 reduced cost, that means for $2,500 you can be with us. That would be for one doctor and 4 members of your staff. And you can go to ultimatelecture.com to get all kinds of information about what's going to take place. Dr. Bergerson used to teach at Northwestern for 25 years. Well, he's going to be back in the classroom. This time it's going to be Northwestern School of Law because, of course, they closed the dental school. But a lot of the alumni are going to be coming. And we're also going to have a number of our premier doctors that will be there and that will be speaking. And even some of our international distributors are coming in. You'll be able to see some of the case studies that a lot of the doctors over the years have really found to be a great example of exactly what these appliances are capable of. But I'm going to also tell you that if this is not something that's going to work for you for some reason on those dates, maybe you're in Orlando right now. Well, tomorrow and the next day, we've got something going on that walk in the door. The CEO of the company is there. Be happy to handle that. We're going to be in Charleston, South Carolina. Could not be happier. We've got doctors there that have been doing this for several years. Another one coming up in Austin, and that's at the end of the month. And that one, we have one of our doctors flying in from Hawaii, an orthodontist. We have somebody who is really well developed into the area of sleep, but also in the Hispanic community. And we also have a 4th generation dentist who was a product of the product and was a child patient who's coming in. So we're going to have Dr. Gonzalez, Dr. Wilson, and Dr. Umbrello at that one. And then the big one, this is what I'm really trying to get your attention for. And let me make this point, that if the doctor were able to come and join us in the Chicago lecture on the 4th, maybe you see that we're going to be in your community or near enough to your community that it would make sense for you to actually attend one of these other lectures. But if the doctor wants to come and be a part of the one in August and do it at the reduced cost of $2,500, they can do that, and then join the lecture with the other members of their staff when it does come to their city. Okay, think about what I just said. You could, the doctor, come to Chicago, have the $900 reduced cost, and then when it comes to your town, maybe it's going to be in Columbus or Dallas, you could actually have the 4 members of your staff come because you've already paid for that package. So I come back to the fact that it is a 50-year, which makes it kind of a once-in-a-lifetime opportunity to get to know or revisit if you're one of his students, or, you know, come for the first time and hear from the people that have been working for so many years. And I do know also that, by the way, a number of hands went up during Diana's conversation. And so if you have a question, please don't hesitate to let us know. But Diana, I want you to, because this is something that was kind of a, oh, am I sharing my screen? Am I not sharing my screen? What happened? Let me come back. Hold on for 1 second. Sorry about that. I'm going to tell you what you've missed by not seeing this. New share. Are we, is that able to be seen now?
Yes.
Okay, super. There we go. This is, I'm so sorry. This is what I was trying to tell you. When I said that parents are learning more and more about this, a press release that just went out illustrating the face of a child, that when you're able to line them up side by side, you've got evidence that this is doing something so dramatic. Yes, the parents are able to see that my child is sleeping, that the bed wetting, all of these things are happening. But when you see the illustration, they want to know, where can I find the dentist who can do that for my child? All of these things that can change their life. UltimateLecture.com. Again, a $900, and the code for that is the word 50, lowercase, $900 reduced. So instead of paying $3,400, you would pay $2,500 to attend this in Chicago. Or like I was saying, there are a number of other locations that that we have lined up into next year, and we're adding to them all the time. Doctor, you can go to the Ultimate in Chicago, and then come back and have your staff attend with you again as a refresher for you, and to get everybody kind of swimming together and in rhythm on a later one if it's coming to their town. So as I was saying, Diana, to talk about kind of in closing, or as anybody might want to put forward a question, Dr. Bergerson has been doing this for decades, and he has said that there are 3 things that have really moved the needle in this profession. And the first one is the introduction of fluoride. And that when he would go overseas and see the difference in the dental, condition of children's teeth and to what was happening in the United States, it was just remarkable. So fluoride was number 1. And the number 2 thing was the implants. And that really has dramatically changed the dental health of adults all over the world. And now it's sleep medicine. And that is the number 1 topic. If you look at what's going on at any of these conferences, it's the number 1 topic. So let's just present to you that you have the number 1 company. There is nobody that shares a stage with Orthotain's product, their patents, their highly advanced design that simultaneously functions in the mouth for the child. Nothing compares to it. There may be something out there that does 1 or 2 things, but nothing and simultaneously does everything. So I would encourage you to be a part of one of these, and first and foremost, please come and join us at the 50-year anniversary. There's going to be a dinner reception, and everything is going to be very well covered, and it's going to live on in infamy, because a lot of this is going to be done with our online portal opportunity to have the same CE certification. So we give you the possibility of doing it online or live at a lecture. But in all your years and all your speaking, Dr. Batoon, as you look at the different topics, the attention that it draws, the value that it brings, the ability to change a practice and to change your community, how do you talk about that topic?
Well, I have to share with you, I'm in Scottsdale, Arizona, and that when I first opened my practice, there was probably 4 of us in that area. Now there's probably maybe 17 dentists with a 3-mile radius. So that's the thing. There's a lot of dentists, and why would they choose me over the guy upstairs or the guy next door? Well, our highest number of new patient referrals is actually HealthyStart patients. And that's the thing. Moms talk. I'm a mom, and whenever you learn something that has benefited your child, you share it like crazy. So that's what happened. One mom shared with her sister-in-law, and you find that you're getting these people who, number 1, are paying attention to less invasive. They're paying attention to more natural options for their children. And that's what HealthyStart system does. What it also does is my staff loves doing HealthyStart cases. It is so much different than getting the CIRAC machine ready to do 2 crowns within an hour and a half on a busy day schedule and do everything else in the schedule. You find that this type of dentistry it's fun. And I think our profession needs to do more fun things nowadays. But what I wanted to get to the point is that people talk, and when you've helped their child in a way that is different than what they've ever known, they're not going to believe you. They're going to go from, oh my gosh, what, they did this, to, I'm mad, why didn't my pediatrician tell me this? Or why didn't my pediatric dentist tell me this? Or why am I just hearing about it now? Well, to be honest with you, in dentistry, they talked about, prepping using the right burr, prepping the proper line angle, picking the right shade. They didn't talk about airway. But what's really important is there's a link. Dentists have to pay attention to this, and it's better to get on the ball now, to be ahead of the curve before everybody else finally figures out, wow, this is a great thing. This is a great company. I need to get on board. So it's done wonderful things for my practice. It's made me become more happier about going to work. It's just a different types of dentistry. And I think when you're someone like me that's done everything, you want to do something different, you need to look at this, because there are so many children out there that need your help.
Diana, you talk about your children, and I'll say that it's my grandchildren that have been so impacted by this. And the doctors that I spoke with today and actually interviewed was talking about the fact that when he saw it work for his children, he and his wife talked about all the different things, and being told that their child should be held back 3 years in a row, but they knew this child was smart, and then they see all of these things change. The whole family dynamic changes, and that's why we have so much passion. I've got 25 years in broadcast news. I've never had any opportunity to be involved with something so much bigger than any of us, but something that changes lives. It's so purposeful. So, when you think about what are you going to do as the doctor with your practice, with you in your profession, I'll say that another one of the doctors said, every year I've got to decide, okay, what kind of class, and there's nothing new. I just don't feel like it's really changing anything. So I would say, in everything that you've heard tonight, you've got to think about what will expand your practice. Well, I will tell you that the children between the age of 2, 4, 6, 7, 8, they're somebody that's on hold. Don't put them on hold, because every day they wait is at night they're not sleeping well. So now this entire group of children that are your patient base that are needing you so badly. And another thing is that this is something that the patient has a great experience. So it's something that you can feel so good about. There's not something that's painful. This isn't the standard thing that, so many of my own children with the braces, there's a downside to that. And there will always be children who will need braces. There will always be that. But this is
right.
So proactive. And the last thing, you just said it, Diana, this differentiates you, among all the people who are, and the families are going to come through your door with a problem, be able to address it.
Right. So, Kathy, there's a question, and the question was, do you take CBCT scans before and after HealthyStart treatment? I will share with you that I don't have a CBCT scan in my office. I was looking at it originally. I will tell you there's a lot of debate, especially in sleep medicine, whether taking CBCT scans on children is appropriate, number one. Number two, the position of a CBCT scan is taken standing up. So is that a true indicator of a child's sleep pattern? I will tell you what's more accurate is, and I don't know if the doctor has access to this, is either working with a sleep lab if you suspect that the child has sleep apnea, or if there's a home study test that could be prescribed by either the pediatrician or a pulmonologist or a pediatric pulmonologist, working in conjunction with them. I will share with you that sleep apnea is still a medical diagnosis and should be evaluated by a physician. So I have a relationship with the ENT in my area, a pediatric ENT in my area, a pediatrician office, a group practice. And so they know what I'm doing in my office. And so when they suspect that it is not allergies, that the child maybe does not have swollen adenoids or tonsils, and that they do see that the child predominantly mouth breathes, they'll send them to my office. And you'd be amazed at how much a habit corrector can correct that. So to answer your question, I don't, and I don't feel like there's a need, because what we find is predominantly, and you can see on a lateral ceph too, if you have a lateral ceph, like the pictures we showed in the slide, you know, restriction of airway. So I hope that answers your question.
I don't know if we have any other questions. Susie, let us know if that's the case. But once again, I'm bringing up the ultimate lecture, because it doesn't get any better than having the inventor himself talk about the appliances that he has created, the evolution, the discovery along the way, and you know how initially they thought, oh, the kids are happier, their teeth are straight, more evidence that it's working, and so they're just happier and they're doing better. Well, they then came over various means of tracking that actually it's changing so much physiologically that it's not just that they feel better, kind of emotionally. This is really making change. So the ultimate lecture, having people from all over the country, all over the world, the inventor himself, reduce cost. You can go to ultimatelecture.com. You can also just call directly to the office and they'll help you set up. But you can register online, and all of those things. The message is there, and the community needs you. There are a lot of families that walk through the door, whether you're a chiropractor, a myofunctional therapist, anybody in the medical field. You're the doctors, and this is my final thing that I want you to talk about, that somebody just asked. You know, the dentist is the person doing this, the oral physician. Well, who else could? I mean, you're the ones with all the equipment and the trained staff. So could you address that, Diana?
I'm sorry, Kathy, can you say that again? I'm sorry.
Sure. I know she's been holding back a cough. The fact that the oral physician, dentist or orthodontist, that you have all the right equipment, that you have all the right training, that's the area of study. So as the doctor who's handling things like bedwetting and growth and development, that you are the absolute right doctor for the care, that's the new standard of care for the child with all of these things and in these early growth and development years.
Yes, I mean, a dentist, you're evaluating their airway and the causes and effects of what's happening to a restricted airway if you suspect that that's the case. So it is very, it's adequate for a dentist to evaluate that the signs and symptoms are related to maybe a constriction of the maxilla, a constriction of the mandible, and poor tongue position. You're just doing what you normally do, but you're thinking outside of the box. You're looking at things different way. And so in dentistry, we have a habit of, okay, this is how you do a crown. You make sure that you're doing a crown because there's decay. You prep it a certain way, and when you cement it and you're done. HealthyStart is really thinking outside of the box. You have to look at everything surrounding this child. What are the symptoms? What are the signs? And evaluating how you can help this child. And that's where HealthyStart comes with the diagnosis to help evaluate what types of appliances would be adequate for that child.
Wonderful. Well, I think that you've covered an awful lot of territory, and the next step for these doctors is to join us either online for a class, and that's a great option. And if not, we'd love to have you at any election conferences that are coming up. So with that, I would like to say for Orthotain and HealthyStart, I'm Kathy Turner, appreciating that you're with us tonight. For Dr. Diana Batoon, who has been battling through a little bit of a cough pressing, good job. And for Susie Lafredo, who is working the technical side of the operations here, we're glad that you were with us. You can call to make sure that you get that CE credit to 844-KID-HEALTHY, or info@thehealthystart.com is fine too. Again, info@thehealthystart.com. You're able to get all of these things addressed, and we want you with us. We look forward to helping you in your practice, helping the patients and the families in your community. And with that, let me say good night. Thanks for joining us.
Good night.